Joining us now is the Chief Medical Officer at the Oakland County Health Division, Dr. Russell Faust, back with us once again on the Oakland County Megacast. Dr. Faust, thank you for being here.
Good to see you again, Tyler. Thanks for inviting.
Yeah, good to see you as well. So the BA2 variant of COVID-19, it seems to be becoming more dominant in the U.S. as of past Wednesday. Michigan reported 3,215 new cases of COVID and 70 virus-related deaths on Wednesday. It's an average of about 643 cases over the past 5 days. At this moment in time, definitely less drastic of a COVID-19 situation than the last time we spoke. But where does Michigan and particularly Oakland County stand on the COVID-19 front at this moment in time?
Well, I think overall, we still have some pretty good news. This week, CDC reports that we are at 71 cases per 100,000 of population, which still keeps us in the low transmission category. And I think, that's where we want to remain. We're seeing just a mild upcreep versus last week. But overall, we've been, in the downtrend for a couple months now. And overall, I think this is all good news. I mean, I think the thing that gives me great hope is that unlike what had been seen in Europe, say Denmark, specifically when this BA2 Omicron variant arrived there, they went into another huge surge, just an enormous surge. And we haven't been seeing that here. Omicron BA2 has been present here in Oakland County now for nearly 3 months. And the fact is, it's just kind of creeping up in terms of its takeover. It's about 70 to 75% of all the cases right now in Oakland and across state. But the fact is, we're not seeing that surge. And I speculate that the reason is most of us have already had COVID, or we are fully vaccinated for COVID. And so our level of immunity in the community is very high. And I think what we're seeing is whereas people are still transmitting at a low level, people are not really getting that ill. Now, having said that, this is not yet endemic. That is, it's not like influenza, which is just everywhere. COVID is still killing people. People are still dying at about 10 times the rate they do for the other respiratory viruses, including influenza or flu. So this is still a dangerous virus, and we still need to take precautions. A mask when you're out in public. I'm hopeful now. I'm very optimistic now that we're headed into warm weather that we can take a lot of our meetings outdoors. We can open the windows and ventilate our offices when we do have meetings. I think overall, we're in a very good place right now in Michigan, in the country, and especially in Oakland County.
So we previously, last time we had you on, we were in the middle of a COVID-19 surge with the Omicron variant. At that time, statistical models from the medical community were showing an expectation that that surge was going to at some point taper off and then dramatically reduce. That model has seemed to have come to fruition at this moment in time. Where are those statistical models at now for our near future? And I would presume they probably don't go as far as next fall, but I would also imagine that next fall, as the weather starts to get cooler, that would be the next time potentially, if we don't reach an endemic stage by that point, which is not all too far away temporally, that could be the next choke point of this pandemic where surging cases could become a problem. Where do the models show us going with COVID-19 at this point?
I think the good news is that we have been a surprise to the models. Most of the models are based on what we see kind of headed this way. We're able to predict, we're able to model things based on what happens, say, in Europe or in Australia or South America or the UK specifically. And we're not seeing that. So I think we are now in a surprise phase, and that the models predicted that when Omicron BA2 hit here, that we would be surging again, and we're just not. So again, I'm cautiously optimistic in that, as we move through the summer months, we'll continue to at least stabilize, plateau, if not continue a downtrend. I am concerned for next fall. because human nature is, we see some good signs like this, and everybody thinks, no, we're out of this pandemic. Start to celebrate, not wear a mask, not maintain distance, not wash our hands, not take those usual, mitigating actions. And we may be in trouble again when school comes back in next fall. But I do want to emphasize, we've had little minor blips. We here at Oakland County are one of the many kind of nodes on the network where our laboratory is sampling wastewater in the community. Wastewater is just a euphemism for sewage. And twice a week now, we're sampling at 17 individual sites. And during the time when, after a lot of the schools, colleges had gone on break and then returned, folks had traveled, had let down their guard, not worn masks when they were in crowds. We had little blips in some of those dormitory populations, for example, but we just didn't see that continued. We didn't see the transmission. And again, most of us have either had COVID or been fully vaccinated or both. And I think we're in a very good place right now.
We're joined by Dr.
That was a long ramble. I don't know whether I answered your question, Tyler.
No, you did. We're joined by Dr. Russell Faust, the Chief Medical Officer at the Oakland County Health Division, joining us on the Oakland County MegaCast. You can learn more information and keep up to date on COVID-19 from the Oakland County Health Division by visiting civiccentertv.com/coronavirus and clicking on our Oakland County link, which will take you directly to their COVID-19 specific webpage where you can learn more information about COVID-19 in Oakland County, as well as vaccinations and booster shots, should you still be in the need of either at this moment in time. So, Dr. Faust, what are some of the other lessons that the medical community has learned from managing this crisis for these past 2 years plus, and how does that help to inform other minor medical crises that may pop up in the years to come, or the next great crisis like a COVID-19 situation that we could have in the future?
Thank you. I love that question, Tyler. We've learned quite a bit. We've learned to be prepared. The last government regime basically had dropped the ball, and many of our warehouses that should be stocked with masks, gowns, gloves, etc., just weren't. And we're well stocked now, nationally. The other thing is, right now, all of the local health departments are pretty well-oiled machines now that they've been doing this for 2 years with regard to testing and vaccinating. The outreach clinics, they're just so good at it now that I think we're well prepared for the next epidemic or pandemic, as long as we maintain our readiness. I think we're certainly in a better position now. And I do want to emphasize that I'm grateful that the CDC at the federal level and state level has established this national network of collaborative labs and water resource commissions and public health teams to monitor wastewater. And already we're beginning to apply that to other viruses and other emerging pathogens that we're just seeing kind of pop up now. We're beginning to apply these methods to keep the public safe. So I think a lot of good has come out of this.
So let's go into more detail on the wastewater testing. How does that testing then inform the next actions that are being taken by a health department, whether it be Oakland County, surrounding areas, or in a partnership between tri-county areas or at a state or regional level? Sure.
Well, the big benefit with regard to SARS-CoV-2 that causes COVID-19, the big benefit is that when we as we become infected, actually excrete in our stool, in our wastewater, we actually excrete viruses or particles of the virus that are detectable through testing. And the wastewater, prior to actually becoming clinically infected, that is manifesting the infection symptoms, and prior to us shedding virus, respiratory virus droplets. So the beauty there is that when we see that upsurge in virus and wastewater, we know that clinical cases are beginning to develop. And what we've been doing is monitoring wastewater in various congregate living facilities, dormitories, for example, and going in, testing everybody, finding the 2 or 3 people that are infected early and isolating them before they're able to transmit to everybody else and stopping an outbreak. So I think that's the model moving forward. Not all viruses have that kind of life cycle or presentation. But for those that do, the other coronaviruses and many other viruses, that's a good model. And I think the other value is that, as you point out, those collaborative teams, those partnerships moving forward have streamlined this process. And again, we are applying this to other hepatitis viruses, other coronaviruses, rather respiratory viruses, and some of the other emerging pathogens. And be happy to talk about that sometime, but that would take more than we have today.
We're joined by Dr. Russell Faust, the Chief Medical Director over at the Oakland County Health Division, joining us on the Oakland County MegaCast. More information on our website, civiccentertv.com/coronavirus. You click on the Oakland County link. It'll take you to the Oakland County Health Division's COVID-19 webpage, so you can learn more information about what they're doing to prevent the spread of COVID-19, to combat COVID-19 cases that are in Oakland County, as well as information on where you can get vaccinated or get your booster shot locally in the Oakland County area. civiccentertv.com/coronavirus. Right there at the top of the page, CDC, NDHHS, Oakland County is the third to the right at the top of that page. Dr. Faust, as we've seen more variants pop up, it seems like the last couple variants, Omicron and even Delta, have been more highly transmissible, not necessarily producing stronger symptoms or a greater chance of negative symptoms. That's probably
more severe disease.
More severe disease. Has kind of been the trend. It was what was seen more with Omicron. It's what's been seen with the BA2 subvariant of Omicron. As you and others on the scientific side of things in battling this pandemic are looking at COVID-19 as it continues to vary over time, is that kind of what's being imagined as these future variants are going to continue to be? They're going to be more easily spread, but maybe not be as deadly until we reach a point where we have seasonal uprisings of COVID-19 cases, but they're not at a point where they are at pandemic proportions that are overwhelming hospitals.
I think that's a pretty insightful question, Tyler. So the variants, every active infection is basically a factory of additional mutations. This is a mutating RNA virus. So every active infection produces more variants. The only variants that really survive or catch on and are transmitted are those variants that are more easily transmitted than the existing variant that's kind of spread through the population. So in order for a variant to really take over, you really can only do so by being more easily transmitted. Stickier, stick to the receptors a little bit better. There are many, possible mechanisms to be more transmissible. But yeah, I think moving forward, that's what we can expect. And I think as across our communities, the level of immunity is maintained or increased either through continued vaccination, as we do for influenza, or through natural or native immunity by being previously infected. I think moving forward, what we'll see is more easily transmitted variants, but less severe disease. And in fact, we see that right now. We're seeing transmission in the community at low, we're still in low level transmission, but we still see cases. But the difference is they're not filling our hospitals as they did, a year ago. They're just not filling our hospitals. And when this is the number I check on a daily basis, because this really gives us an insight into how well we're doing in the community, is how many cases are in our hospitals. And it's extremely low. It's very reassuring. But I think you're correct. That's what we can expect.
And so, Dr. Faust, earlier on you mentioned that we're not at the point where COVID-19 is endemic. We are at a very low spread of COVID-19 in comparison to the past. The community spread isn't as severe as it has been, and it continues to trend further toward going down. And then maybe this is a more complicated question than simply at a county level, and I know it is because because this is a pandemic, it's worldwide. Where is that point where the scientific community, where the medical community would be able to properly declare something like COVID-19 to be reaching an endemic viral spread?
Yeah, that is a very complicated question, or the answer is very complicated. And I think there's a fair amount of disagreement among the medical and scientific community for what that trigger is, what that threshold is. What do we need to reach in terms of level of transmission? But I think really a lot of it has to do with the lethality of this virus. And so, the World Health Organization is still saying that we're still a way off from COVID-19 being endemic, but really the pandemic is not only the global aspect of this, many countries involved, but also the rapid growth of transmission and infection. We're really kind of coming out of that pandemic phase. And I think if we continue to be plateaued or kind of downtrending as we hit next fall, I think it will be reasonable to consider ourselves out of an emergency or pandemic kind of phase. Perhaps not technically endemic, according to all the medical scientists, but I think that would be a great milestone. I think beyond that, I think we'll have little epidemics of geographic clusters of infections and outbreaks. But I think we can all look forward to that time.
Dr. Faust, before we let you go, anything else at this time that would be important for people in Oakland County to be keeping in front of mind on the COVID-19 front or other things medically in the community?
Yeah, two things. And thanks for asking. Really, if you haven't gotten your flu shot, get your flu shot. If you are co-infected with SARS-CoV-2, COVID-19, and influenza, your mortality risk goes up more than 6 times being infected by either one alone. You don't want to be infected with both. So get your flu shot. And the second thing is make sure that you're optimally, maximally vaccinated against COVID-19. We're out to a second booster now for eligible populations, but check the website, see where you are, get your second vaccination, get your booster if you qualify, get your second booster if you qualify, and stay healthy.
Dr. Faust, thank you for joining us.
Thank you, Tyler.